This is diagnostic hysteroscopy. The patient is asked to report to the hospital 1 hour before the procedure. She is fasting for 6 to 8 hours. We are just getting ready here now.
This is the consent form which is mandatory to every patient before going for any procedures. It is taken before taking the patient into the OT, and we explain the procedure in their own local languages and make sure that we clear all the doubts before taking the patient into the OT and take their consent for the surgery.
Diagnostic hysteroscopy is normally a short procedure that lasts 10 to 15 minutes. So as an anesthetist, you prefer giving general anesthesia as you want the patient to go home in 3 to 4 hours. So normally what drugs are used here are all short-acting drugs, and every patient has to be evaluated separately because some of them do have comorbidities. Like this lady that I'm doing now is a hypothyroid, and based on that we give the drugs.
This is the sterile trolley for the procedure. This is hysteroscope and telescope. This is speculum, and this is the valsalum, and this is the curate, and this is a sponge holder. This is a dilator for dilating the cervix.
So to start the procedure, I have scrubbed up using a sterile gown and a glove. I start the procedure here now.
So this is a hysteromat which is important to maintain the pressure inside the uterine cavity where the water will go through that. This is the normal saline, which we call it as water for us medically, and that has to enter through this so that the normal saline is pumped into the uterine cavity under pressure. So this is the monitor again. So we have two monitors, one for the assistant to see and the other one for the surgeon to see. This is the unit, the camera unit, which helps us in providing the light and also where all the cables will be connected. So this is the light source where the adjustment of the brightness can be done. 2.9 millimeter hysteroscope, where you can see that there is a connection for the saline, that is the normal saline, that is a liquid, which will go into the uterine cavity. So this is the camera head, and this is the light source where we can illuminate or light up the uterine cavity to check. When do we do this procedure? This procedure is done when we are suspecting any polyps, fibroids, or when there is any other uterine pathology inside where we want to check whether the uterus is normal or is there any abnormality. In this case, we are doing this because she has had a failed IVF, that is failed embryo transfer, which is failed to get implanted, and we want to know if at all if there is any infection inside the uterine cavity. So this is the screen where you will be seeing the findings of the hysteroscope, where once we enter inside the uterine cavity, if at all if there is any pathology, you will be able to see. So this is smallest of the hysteroscope which is available. Usually we do this procedure under anesthesia, and the patient stay in the hospital is about for 4 hours. And this is a very safe procedure. It doesn't require much instrumentation. There is no cut, there is no suture when we do this procedure. This will take roughly about 10 to 15 minutes to get over. If at all, if there is any other procedure along with that, that is like something like a uterine septum, then we kind of combine the procedure at the same time. But this case, today it is only as a diagnostic hysteroscopy where we are checking out the uterine cavity if it is okay for the next FET, that is next embryo transfer.
Here I am entering into the uterine cavity through the vagina and the cervix. As you can see here, I have switched on the normal saline flow, and I will be looking at the screen while I am doing this procedure. So the lights are turned off. You can see that the cervix is entering now. The scope has illuminated, and you can see the mouth of the cervix, and the uterus is now entered. This is the endometrial cavity. The cavity looks like there is a few spots of inflammation which can be tackled with infection. After this procedure is done, I visualize the ostia, that is the opening of the fallopian tube. I visualize all the 4 walls of the uterus, whether they look normal for any evidence of polyps, fibroids, or any septum. And after the procedure is done, which will take about 5 minutes, so the patient is wheeled out into the recovery. We observe the patient for 2 to 3 hours, and from here the patient is discharged.